Then, of course, odor is always an issue. Yes, when you have an open area.
Yes.
Yes. So there are things that will help the odor, but what you really need to do is figure out why the odor is there.
Yes.
And please, when you're taking your dressings off, don't smell the dressing because it will smell. Okay? Do your shower first and then see if the odor is still there. What you want to know, if the odor's there, one of the things that you get suspicious of is that there is an infection. Mm-hmm. And with most of the episodes of HS that you get, they're more inflammatory and not infection, so you don't need antibiotics for every time. But you can't say, oh, it's inflammatory and I don't need an antibiotic. You can't take that chance. Mm-hmm. Really trust your own gut instinct and what your body is telling you, because your body will be giving you messages and signals that this is not just a normal flare. Okay? So if it's infected, it will be very, very much more tender to touch than a flare would be. There will be that odor once you've showered. You can still smell things. And one of the things that we as practitioners need to realize is that when you tell us there's an odor after everything's been cleaned up, there's an odor. Even if we can't smell it, we need to know that you know your body. Mm-hmm. You may get redness around it if the redness goes greater than 2 inches around the area that's affected, so more than 5 centimeters. That may be a sign that there's infection. If you're feeling unwell, that may be another sign that you've got some infection going on there. So listen to what your body's telling you and don't poo-poo it. I know that when you've lived with HS for a long time, you tend to take things for granted, but don't listen to your body. It's telling you something. Okay? That's my lecture for today.
Repeat it. Listen to your body.
Listen to your body. So there are dressings that will help with the odor. This is one that has a silver in it as well as charcoal, and charcoal is the basis of all of these dressings. So this one is will absorb. So this side goes down to the wound as opposed to this side. Okay? This just goes directly on the wound, so you would need to put a secondary dressing over it.
And how is charcoal beneficial to healing?
It isn't.
It is.
Okay. So, but this one, because it has silver in, can help.
Okay.
But just this, what it does is help with the odor.
Oh, okay.
I don't know that I have ever seen anyone with HS use these dressings, but they are out there, just so you know about it. Okay. And then we go down to if you want to put something on that won't stick, these are the products that are available. So this is called Adaptic, and it's like Gelinette in that it's a Vaseline impregnated gauze, so that it won't stick to the wound and helps for ease of removal. This is a product called Release, but if I said Telfa, most of you would know what I'm talking about. So Telfa is actually a brand name, but we refer to the non-adherent dressings like we refer to quote unquote Kleenex. Everything you blow your nose with is a Kleenex. And yep. We should be referring to it as a tissue. We should be referring to this as a non-adherent, but we don't. So this is like a Telfa, which will, it has a coating on it so that it doesn't stick to the wound. The other interesting product that's available is that if you have something, again, this is silicone, if you have an area that's extremely painful and doing anything with it causes you more pain, this is a silicone contact layer. And it has the same backing as the dressings that you've had on your underarm, if you feel that. Feel how tacky it is?
Yeah, that's stickier than I thought it would be.
Yeah. Do you want to put it on? The beauty of this is that it can be left on depending on how much fluid you have coming from the wound. Let's do this the easy way. Depending on how much fluid you have coming from the wound, this can be left on 5 to 7 days, and you do your wound care right through it.
So this never comes off. You
So
just
it doesn't.
redress the
You
top.
just twist it, and when it gets mucky, then you take it off. So if you take that off,
Oh, it comes off very easily. It feels
Yeah.
sticky to the touch, but it
Yeah.
came off very, very smoothly.
okay? Again, the more high tech the dressing gets, the more expensive it's going to be. And then this is the last piece in this segment that we have to talk to. This is a film dressing that a lot of people will put over another dressing to hold it in place. There is a trick to taking this off. Putting it on is not so hard because you take the backing off, then you do 1, and then you do 2. In order to save your skin,
Can I do it?
yeah, you can. Pick up a corner and pull it towards you, just like this. And what is not happening is it's not pulling the hair, and it's not pulling the skin, and it's not doing any stripping of the top layer of the skin.
Mhm.
So that's the way you need to take that off. And if you take that off, you will not end up with the skin irritation that if you take it off the other way. And I won't be mean to you, Stephanie, and take it off the other way.
The other way.
Yeah, that's not practice the other way, yeah. So just remember to pull it, lift it up, and pull it towards you rather than away from you, okay? So that, we have a nice mess here now with all of our samples that we had. But this is if you were having changes in a medical place, or if you were going to home and community care to have your dressing changed, these are some of the options that may be available to you. Okay.